when they boost your copay. Don't you know what to say?
I hope people are asking the next question, really, which is, what can I do? What can we do? And I think that Andy and Walter have painted a picture that absolutely compels us to do something for our own sakes, for the sakes of our families, our children, our neighbors, our parents, and so on. So we have to organize effectively, and that's why the physicians and other healthcare providers who believe that this change is so important for the sake of our patients, and also for the sake of the students that are going to follow in our footsteps, why we have organized, and this is why Don and other people in this room have organized, and the different groups that are reaching out into the enormous extent of society have to work together. So if you're not a member of an organization, please look into affiliating with an organization and contributing in some way according to what you enjoy and what you're capable of doing. That's my plea. Okay, that's...
Okay. Martha, do you want to use the mic?
Everybody should use the mic. Everybody in, nobody out.
Everybody at the mic, nobody out? Okay,
Right.
cool. So, hi, Martha Livingston from New York. I also work with Physicians for National Health Program, though I'm not a physician. And I've been active in this movement for some years. And I just wanted, what Walter and Andy just did reminded me of something that the late, great Tony Mazzocchi used to say. And Tony Mazzocchi was one of the greatest labor leaders that we've ever had in the United States. And so here's Walter. He's like, you know, it's rational. It's patriotic. It's good for business. And here's Andy, like, you know, this system is killing people. And it's also just torturing healthcare professionals. What the heck is going on here? Well, you know, it's no accident, right? That we all understand that this is the rational, clear solution to a problem, but what we're forgetting is ideology. And that is that, you know, it's that camel's nose under the tent or the foot in the door. Once we see that we get together and we fight and we get a rational, humane, morally correct healthcare system, then that starts us thinking, what about child care? What about public education? What about higher education? What about housing? What Mazzocchi said was, healthcare opens a window on the social wage, and that's what the other guys, the other side, doesn't want us to do. And they'll even say to us, you know, sure, it's a great idea, but it's not politically possible. That's why they want it not to be politically possible, and we need to make it politically possible.
I have a question for the panelists about the healthcare reform that happened in Vermont, because I'm curious about it because, you know, in some ways it seems like the first sort of single-payer-esque system, but in some ways it's also not, and is still based on the private insurance companies. So I guess what is your take from people who've been struggling for a national healthcare plan? What does the plan in Vermont do or not do for this movement?
You're right next to him. So, Vermont, Vermont's the home of some of the best single-payer activists in the nation, and it's also a small state. And so, Vermont has had a discussion about single-payer now for over a decade, where you have 750,000 people, not quite, I think it's, you know, just over 700,000 people who all understand some of these issues. And then there's a governor in Vermont who ran on single-payer, and who keeps saying that single-payer is the goal. So there's been a reform in Vermont that would mostly stay within the Affordable Care Act, but continues to put forward the goal of transforming whatever changes are made in Vermont in the direction of single payer. So that's not exactly a single payer system or the implementation of it, but there's an enormous